Today we're going to discuss a case of a patient who had an accessory parotid gland tumor, and I did a transoral parotidectomy to remove it. Dr. Babak Larian from Center for Advanced Parotid and Facial Nerve Surgery. What are the accessory parotid glands? Let's take a look. This is a cross-section of the face. At this level, you can see the upper teeth here. And this is the parotid gland on the side of the face. The facial nerve, which is white here, goes through the gland and comes out and goes to the muscles of the face. And the green are the ducts that bring saliva into the mouth, okay? Sometimes when the gland is developing, an extra piece of parotid stays on the ductal system separate from the gland itself. And if this develops a tumor in it, well, then that lends itself to approaching it through the mouth and approaching the tumor there. The benefit of doing it from this way is that the facial nerve that you are seeing is on the outer surface. So if you try to go from the skin side inside, you have to face the facial nerve. But if you go through the mouth, the facial nerve is more superficial, right? So you're in a safer plane to remove this tumor through the mouth. And generally at the beginning of the surgery, what I do is I put a metal little tube, we call it a little, or a probe, in the duct of the gland, so I can feel the duct at all times, so I can preserve the duct, okay? So this is a gentleman who had a parotid mass. You can see it here, bulging out. On scans, it was clearly separate from the parotid gland. And here he is in the operating room where the tumor is marked out. And here's the marking of the parotid gland, which is in orange itself, and the duct, which is in green going towards the mouth, and the tumor is on the accessory gland, separate from the main parotid gland in orange. So this is the incision done through the mouth. Once the incision is done through the mouth here, then I go in and feel where the mass is. You can see right there. I can easily access it through the mouth, okay? And these probes are facial nerve monitors. So every time I get close to a facial nerve branch, they give me an alert. And in this video, you're gonna see me stimulating through the incision, the area where the facial nerves are, and you'll see movement around the eye. So I know exactly where the facial nerve is as I'm doing this surgery. This is a tumor after it was removed, and the facial nerve functioned properly afterwards. And this is, you can see the image beforehand where the tumor is marked. Here you can see the bulge of it. And this is 6 days after surgery. You can still see a little bit of bruising on the skin, which has turned yellow. A little bit of swelling in that area, but the tumor is out and the patient is doing very well. If you're interested in clear parotid information, visit us at parotidmd.com. Be well.